Okay, so we're going to stay on the same topic, Ms. Bono. Your organization, Every Texan, which I recommend everybody look up because you guys do great work, it focuses on advancing equity for all Texans when it comes to financial security, education, healthcare, jobs. You see the need that a lot of families in our state have. Could you talk about that need and also how Social Security helps them?
Absolutely, thank you for that. Every Texan works directly with organizations like the AARP and smaller community groups like Grandparents Raising Grandchildren to help support public education efforts and advocacy at both the federal level and the statewide level. We also work directly with enrollers, folks who help populations like the senior population access benefits that they need to help them thrive. And I think when we're talking about programs like Social Security, we have to think about it in a broader context than just that program alone. Dr. Sines is absolutely right. It's a numbers game, but it's also a systems game. And the seniors in Texas, especially seniors on a fixed income, are really facing a complicated web of economic challenges right now. From the seniors that we work with, the top of the list is rising housing costs. I think everyone in this room has experienced the dramatic increase in property taxes and also the cost of rent. Texas has been impacted especially hard by that growth. And so according to a study from the Harvard Joint Center on Housing Studies last year, about 30% of seniors in Texas are cost burdened, meaning they spend more than 30% of their income on housing. And we see a similar trend when it comes to health care costs. About 60% of seniors in Texas do not have even $500 saved for emergency medical expenses. Food security is another big one. It's the one we hear about a lot. 10% of seniors on fixed incomes in Texas are food insecure. They do not have regular access to nutritious food, and that's above the national average, and it's slowly increasing over time. And so when we think about programs like Social Security that are supposed to provide stability for our aging population, we know that that demographic is going to be growing exponentially over time. We really need to think about comprehensive solutions to make sure that this population is properly supported in our state.
People who are poor and people of color are going to be are going to bear the brunt of that cut. And as I've indicated, you have the poverty rates already 125% or lower, where about more than 1 out of every 5 persons of color, Latino, African American, American Indian, Alaska Native. We're talking about 1 out of every 5 individuals being in poverty compared to about 10% for the white population. And then among women, women in particular have higher poverty rates as well. With women, it's more than 1 out of every 4 compared to about 13% of white women. So it's really that the racial categories of people of color and women as well. And these are individuals also that do not have other sources like investments, for example, they're less likely to have investment returns, less likely to have 401ks, IRAs, and so forth that they could possibly help alleviate the situation. So those are the big issues. And then you also have, in terms of, for these individuals, they would also be tapping into the resources of assistance from other family members who themselves are also, in many cases, also dealing with economic kind of issues as well.